Gentlemen, may I have your attention, please? The show starts in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go.
Good morning and welcome to Sickle Cell Disease Conversations. Let's talk about Endari. My name is Reverend Zamoria Brandon. I'm the Administrator Social Worker for the Sickle Cell Disease Association of America, Philadelphia, Delaware Valley Chapter. We are a community-based organization established in July of 1982 with the mission of providing supportive and direct services to meet the needs of those living with sickle cell disease across the lifespan. Our agency is one of 54 community-based chapter member organizations under the umbrella of the Sickle Cell Disease Association of America, our national headquarters located in Hanover, Maryland. And locally, we collaborate with 2 pediatric and 3 adult comprehensive sickle cell centers, along with 2 adult hematologists in private practice to provide supportive services to meet the needs of the sickle cell community. As today's Mistress of Ceremonies, I would like to extend a warm welcome to all who have joined us for this morning's presentation. We are happy to collaborate with Emmaus Life Sciences in recognition of October as Health Literacy Month, and extremely excited to have Dr. Corey Hébert as our esteemed guest presenter, who will provide us with more insight about Endari and how it helps to improve the lives of sickle cell warriors. For the past 2 years, we have maintained a collaborative partnership with Emmaus through their support of our annual Walter E. Brandon Sickle Cell 5K Walk and Run, held annually in September during Sickle Cell Awareness Month, as well as their support of our blood drives with the American Red Cross by providing refreshments to all of the volunteers. But before we begin our program, I'd like to take a few moments just to share some tips for today's virtual experience. This is a webinar, and so any comments or questions that you have, you will just place them in the chat, and we will certainly take time to respond to them. We also want to let you know that there will be a Q&A after the presentation. You can put any questions you have at that time in the chat. But before that, we would like to know who's out there, far and near, who's tuning in. So we ask that you put your name, the state you're in, the city you're in, who you are, whether you're a community-based organization, sickle cell warrior, caretaker, in the chat. And we would just love to have that information. But today's educational presentation represents a significant milestone in our partnership with Emmaus Life Sciences, which will include brief remarks by members of Team Emmaus, Dr. Corey Hébert as our keynote speaker, followed by Q&A and closing remarks. So allow me to introduce you to Team Emmaus. We begin with Jason DeSheffy, the Regional Sales Director, will be followed by Tracy Evans, Strategic Account Manager, and last but certainly not least, we have Karen Gant, Community Engagement Manager and Nurse Practitioner, who will also introduce Dr. Corey Hébert. And thank you again for joining today's presentation, Sickle Cell Conversations. Let's talk about Endari.
Good morning, everybody, and thanks for joining us today. Thank you, Reverend Zamoria, for a great introduction. We appreciate you allowing us to partner with you for this great event this morning. My name is Jason DeSheffy. I am the Eastern Regional Sales Director. So for Emmaus, we have 9 strategic account managers in the East, going from Florida all the way up the Eastern Seaboard to Boston. And I'm super excited. You guys, everybody on the call is in for a treat to listen to Dr. Corey Hébert. He is one of our best advocates for the Sickle Cell Warriors out there. And every time I hear him speak, I always learn something new. And I appreciate his excitement for getting better treatment for patients that have sickle cell disease. So I don't want to take up too much time because we're going to have time after to answer some questions. But I would just encourage everybody on the call, if you have questions, if you have experience with Endari or just with sickle cell disease in general, questions that we can ask, please speak up, because it's great for us as a company to understand some of the battles that you all are facing, whether you're a caretaker, social worker, or somebody struggling with the disease, so we can better serve you. And that's really what we're here for. We are champions. We are trying to champion better treatment and better services for you all. So I encourage you to please ask questions and make comments. And I'm looking very much forward to talking to you all and hearing Dr. Hebert's presentation. So thank you so much, and let's have a great program.
Good morning. My name is Tracy Evitz, and I am the local strategic account manager for Emmaus Life Sciences, covering the Philadelphia, actually all of Pennsylvania, New Jersey, and Delaware territories. So I'm the point of contact for any physicians' offices, community clinics, pharmacies. And so certainly I want to thank everyone for joining today, and we're looking forward to a great program from Dr. Corey Hébert. So thank you very much.
Good morning. Good morning. I am Karen Gant, and I am the Community Engagement Manager for Emmaus Life Sciences. And today we just want you to sit back and enjoy the program. We want you to enjoy the information that it's going to be such a treat. Let me just get you excited. I want to get you excited before Dr. Hebert comes on, because we're here to share some very valuable information, some very necessary information about sickle cell disease, and of course about Endari, a treatment option for you. We want you to be educated when you leave here, motivated and transformed, so that you truly understand the treatment option that we're going to share with you. But more importantly, we want you to be able to have better options for self-care and management of your disease process. So as I said, sit back, relax, take in the information, be a sponge, because you're in for a treat. Thank you from Emmaus Life Sciences.
That young man on that little slide there, he looks really young. Before I started the sickle cell fight, I looked really young. Anyway, this is Dr. Hebert. I'm so glad to be here. As we fight this good fight, folks, I just want you guys to understand that we're in the fight with you. This is a daily fight, and I know all of you have had a lot of tough times. I know that you are having all this information thrown at you every day now. And so you're really going to have to be able to look at, the things that are really, really good out there, the things that might be good out there, the things that are kind of good out there. And it's just a lot of stuff. All right. So the first thing I want you to do is just recognize that it's going to be all right. It's going to be all right. Now I'm going to show you a presentation here. I'm going to share my screen. And here we go. We're going to go to a window. We're going to go to this. And we're going to share, and then I'm going to stow the slideshow. All right, so I think everyone can see. I did write a book about this. It's called Sickle, and it's Awakening the Truth About Sickle Cell Disease. And the reason why I wrote this book is because, people out there, 97% of young women that get the diagnosis of sickle cell disease for their young babies had no idea that they even had sickle cell trait. Right. So it's a major issue right now. And I need people to really understand that this is something that we've got to handle. We've got to get this word out there. 4 million people out there with sickle cell trait, and somebody can drop dead at any time. If you go into a high altitude environment, if you work out too much and your bones are hurting and your muscles are hurting, you don't know why. 16 young black men have dropped dead on the football fields of America and NCAA sports from sickle cell trait. And it was the #1 cause of death in new military recruits. It was sickle cell trait, not disease. So most doctors out there, most doctors have never been taught this. So if you go to the CDC website right now, it's clear as day. It says if you have sickle cell trait under extreme circumstances, you can die from sickle cell crisis. So please, if you don't know your trait status, get it, right? So Endari, I have been compensated to tell you this story, but I will tell you this is a very compelling one because Endari is a new medicine. Okay, this medicine is out there. A lot of people don't know about it. The reason why is because there's so many things out there that are flooding you every day. You don't really remember to go back and say, what is this? What is that? And you're just confused. And also for a long time, there was no stuff out there for you to be able to take or new things for you to be able to do as far as your health. You didn't have anything. So the point is right now you have to know that, hey, you got something now. Now, this is an L-glutamine, okay? Now, people have been going round and round. Is this a supplement or is this a medicine? This is a medicine, okay? It's not a supplement. This is an FDA-approved medicine. And you say, well, I've seen L-glutamine at a health food store or vitamin store. Well, you have seen L-glutamine, but not in this concentration, not in this blend, and not in the way that you could buy it from a health food store and use it for your sickle cell disease or hopefully trait one day. And this is very important to recognize because if you could do that and it was the same, the FDA would not have licensed it as a medicine that requires a prescription. Okay, so just remember that. So when anybody tells you, oh, it's just a supplement, that's not the case. Okay, and it's for people 5 years old and older. All right, so this is what I want you to understand. What is happening in your disease? Oxidative stress is what's happening in your sickle cell disease. So you have the stress inside the cell, which is these little tiny firecrackers here. You see that makes a sad face. That's the problem, right? And then the sickling happens. And then once the sickling happens, the red blood cells rupture. That causes the hemolysis and all of the bilirubin and to come into the blood, and that's what causes the jaundice and the yellow eyes and all that stuff and the yellow skin. And then you have the stress inside the blood vessels, and that causes cell wall damage and adhesion. Okay, that's where you get most of the problem, and that's the issue. All right, now one of the bigger issues is that I want you to just look at the same slide, okay? Because this is what's going to show you Endari's difference from what other medicines do. Now, just remember, L-glutamine is already in your body. It's already essential amino acid, which means that the side effect profile is probably going to be pretty low since it's already in your body in a way that you need, okay? So I want you to remember that. So you said, okay, wait a minute. This medicine, which is already in my body a little bit, if I can get a way to get more of it in my body in a very particular way, then it's going to work for me for my sickle cell. Yeah, and I'm going to show you how it does do that right now. Okay, so you get the same thing. You see this glutamine in the cell. Glutamine goes inside the cell. NAD to NADH takes away those little firecrackers. That's the oxidative stress. And then the oxidative stress goes to release to the NAD, and then you have a perfectly elliptical red blood cell. Let's do that again. I want you to see this, right? Because a lot of people work really hard on this slide because it's kind of a complicated thing, but you get it now in the cartoon. You have the oxidative stress that we showed you had all those problems. What happens? The glutamine goes inside the cell. The little firecrackers change the NAD to NADH. The NADH changes, decreases all of the firecrackers, releases the NAD, and then you have an elliptical, perfectly non-sickled blood cell, and everything in everybody is happy. That's very important because when you have this oxidative stress, this is what causes the issue. Antioxidant levels are low in hemoglobin SS patients, okay, compared to patients with hemoglobin AA. Now you look at this slide. So we got this NAD here. That's the redox potential. These are the normal red blood cells and the sickle red blood cells. We looked at this group in Saudi Arabia. And just remember, there are more people in the Middle East with sickle cell disease than in the United States. People don't realize that. A lot more. And the reason why is because they don't do universal testing. So they don't even know that they have this until they get sick. So that means that if they don't get sick and they keep trait, they don't even know that they have trait, which means it's going to be a real problem for them, right? So that's the bigger issue here, right? So you see, you look at these patients over there, and then when you see them, you look at the sickle red blood cell and you look at the normal red blood cell. What you see is the change from baseline after 4 weeks of oral glutamine, L-glutamine therapy at 30 grams a day, the redox potential. The redox potential changes. It restores the antioxidant NADH, and then that is normalized redox potential, which means you're going to have decreased symptoms. If you look at this study, you see all of these sickle red blood cells. That's a lot of them, right? A whole bunch. right? That's what causes problems. After this study, after 12 weeks, well-rounded, less sticky RBCs. I don't even see just one sickle cell in there in the whole place. All right, so just remember, 12 weeks, that's all it takes. Now, I want to show you this clinical trial summary because this is where the rubber hits the road. This is where your doctor, if you go to your doctor and your doctor says, I never heard of Endari, well, you need to kind of deal with this. And the folks that talked to you before, the first 3 folks that talked to you before I did, they're going to tell you where to go. Because let me say something to you right now. If you have a doctor that you don't like, change him. Change him or her. You have your life is too precious. If you have a doctor that you feel that doesn't answer your questions, change them. If you have a doctor that says they never heard of a particular medicine you want to take, change them. But what I will tell you is that for this particular medicine, you can go to our website. And they're going to tell you about this website, and you can actually go and talk to one of our doctors. We'll get you on the medicine. You don't have to worry about it. You can go to your doctor and say, I already am on this medicine. Now, you can talk about it if you want to, all right? But we have to know, we always know that there is a racial component to patients that are being taken care of that have sickle cell disease. We know that people really, tend not to treat African-American patients as well as other patients. We know that is a fact. That is not something that we just think about. That is a proven fact. So your doctor may or may not have heard of it, may or may not care. May or may not. I'm not saying anything bad about doctors out there. What I'm saying is there's bad teachers in the teaching profession. There's bad postmen in the postman profession. And there's bad doctors in this profession. And what I'm saying is they're not bad because they're trying to harm you. They just don't know a lot at sometimes about things that they have to learn about at this point. So please, if you can't get solace from your doctor, then you need to make sure that you get another doctor or come to our doctors, and you can do it online. We'll talk about that in a minute. But this is what I want you to see. When you take Endari, you're going to have 25% fewer pain crises. That's regardless of hydroxyurea use. Remember that, okay? Now, when I tell you fewer pain crises, everybody has a pain crisis going to have fewer hospitalizations, 33% fewer cumulative days in hospital. And this is what's the real deal. This is what kills you. Acute chest syndrome. We have a 63% lower incidence of acute chest syndrome. That is huge. Now, I want you to look at the study. Who was in the study, right? Always look at the study, because people can make you say can say anything in the study, but this is really important. 5 years of age or older, documented hemoglobin SS or sickle beta thal, 2 vaso-occlusive crises in a year or 2 or more. You could use hydroxyurea, and you could have had a transfusion. No renal disease, that's kidney. No liver disease, that's hepatic. No pregnancy or lactating patients, and we didn't want you to get blood products within 30 days of screening. The primary endpoints, we got to say how many sickle cell crises you had through week 48. Sickle cell crisis was visit to a medical facility with sickle cell pain, and you had to get some medicine IV. Also, it could be Toradol or narcotic, acute chest syndrome, priapism, or splenic sequestration. Also, how many hospitalizations did you have for the pain? How many ER visits did you have? Because it's all cute when a little 3-year-old girl goes to the ER, right? It's like, oh, I'm in pain, and everybody's like, oh, let's treat her. But when you're a 25-year-old man and you're, 6'4", black man, 250 pounds with sickle cell, and you're talking about I want some morphine, they're not so nice to you. So my job is to keep you out of the hospital, okay? So we also looked at the hematologic parameters, hemoglobin, hematocrit, and reticulocyte count. As a matter of fact, these results were so compelling that the New England Journal of Medicine wrote an article about this phase 3 trial of L-glutamine. And look at this. Yutaka Nihara, he is the CEO of Emmaus Life Sciences, the lead author, because they were like, wow, this is such great information. This is, we got to promote this. And we got to make sure that people know that this is out there, that you can get this medicine, right? Not only that, but the FDA used that study to approve this medicine. So let's talk about the pain crisis. We talk about 25% fewer pain crisis. This was with or without hydroxyurea, which means hydroxyurea really wasn't doing its job if you have a 25% fewer pain crisis with or without hydroxyurea. Okay, so that's a big, I know a lot of y'all are out there on this. So 25% fewer pain crisis. Look at this. I want you to see. When you look at the separation from placebo, Endari started at the beginning, was same as placebo, and then separated and keeps separating, okay? So that means at any one time during the study, patients on Endari had fewer pain crises than those on placebo across the board, okay? Which means that it's working and working well. Fewer hospitalizations. We know that that's one of the major issues. That's the life disruptor. These hospitalizations. You'll be in the hospital, and let me tell you, 150,000 people in the United States are going to die this year, every year, from hospital errors and nosocomial infections, meaning infections you got when you got to the hospital. So you got to stay out of the hospital, okay? But fewer hospitalizations, 33%. That messes with your money, messes with your time, messes with everything. You got to stay out of the hospital. 41% fewer cumulative days in the hospital. And this is the key, 63% fewer patients with acute chest syndrome. And if you don't get anything from me today, recognize that many decreased acute chest syndromes. I mean, come on. You know that if you've ever had this is painful, it's scary, and we got to decrease that because that'll decrease the death rates. Also, median time to first crisis delayed by 30 days, which means you are going to delay that first crisis by a whole month if you take Endari. So you want to do that. You don't want to have these pain crises. So just as a recap, right? Fewer pain crises, 33% fewer hospitalizations, 41% fewer days in the hospital, 63% fewer patients with acute chest syndrome, and a 30-day delay in time to first crisis. Now, we got to talk about the safety, because if there was a lot of serious adverse events or any type of issues with you have a lot of side effects, then I wouldn't want to take this medicine. I'm not taking anything where I have more side effects, right? But this medicine, like I told you, you already have this in your system. So it was well tolerated among pediatric and adult patients. The SAEs were higher in the placebo group. Now, SAE is a serious adverse event. So if those events were higher in the group that was on the sugar pill and not in Endari, what does that tell you? That means that the amount of serious adverse events, you didn't have that with this medicine, as opposed to some of the other medicines you may have to take. The AEs of continuing to discontinuations were infrequent, and the safety profile was similar to placebo. It's conditionally an essential amino acid. It's oral, but it's a powder. Okay, so people say, well, I'm not used to taking the powder. Well, aren't you sick of taking pills? And by the way, you forget to take your pills all the time, because you don't have to take a pill to live. Okay, you don't. But you got to drink something to live every day, or you'll get dehydrated and you'll die. That's not people with sickle cell, that's anybody. So I want you to think about it, that this, you can just put it in any drink. You got to drink 4 or 5 times a day. You have to. So just put this powder in there, shake it up and drink it, and be done with it. 5 years of age and up, with or without hydroxyurea, are the therapies, and for all genotypes. Disclaimer, we know that the most common adverse events, obviously greater than 10%, constipation, nausea, headache, abdominal pain, cough, pain in the extremity, back pain, and chest pain. The adverse reaction leading to discontinuation of treatment, it was 1 case of hypersplenism, abdominal pain, and dyspepsia, burning sensation, hot flash, and we have not established when you can use this in patients under 5 years of age. We don't know, and that is it. Now, I will tell you, folks, I'm going to stop sharing this screen, because I want y'all to understand that this is a real deal, okay? This is the real deal. If you do not know that your doctor can write this medicine for you, the people that are on this line are going to be able to help you get and navigate this. We have patients right now, I don't know if y'all listen to Steve Harvey Morning Show, but Junior from Steve Harvey Morning Show is a patient of mine. He's on Endari, and he is doing so well. We're about to go start this whole tour, because he wants to spread the word that he's not having side effects, that he's not, and he's almost died 7 times. And he is on Endari and doing very well. And that's really important, because people need to understand this, because a lot of doctors, like I said, have not even heard of it. You need to put the power back in your hands. Power to the patient. Power to the patient. We have to get the power out of the doctor's hands into the patient's hands, so that you can have a better outcome. So thank you very much. I'm going to turn this back over to the group, and we're going to have a couple of questions. I am actually practicing physician, so I have to jump off in a little while, but I will jump back on and answer some questions, because I think my Emmaus team will be able to field some questions in the meantime. So I'll answer some right now. So thank you very much, and have a great day. Power to the patient.
Thank you, Dr. Hebert. This was wonderful, wonderful. Hopefully that you've got some information that you can use, information that you can harness those tools that you need to be the best you that you can. And we want you, and as Dr. Hebert say, if not you, then who? You've got to participate in your own care. You've got to observe yourself and understand what works for you, what best works for you. Know your body, know your mind, and know your spirit. And those are winning combinations. We hope that you would consider delving deeper into using Endari. We do want to thank everybody for coming on today. As you can see, my Emmaus team is here. Dr. Hebert, and I failed to say this earlier, but Dr. Hebert is our Director of Medical Research and Development. So he's right there in the forefront, getting information on a daily basis that we can better improve Endari, of course, for you, for your use. So at this time, just don't be afraid to ask questions, inquire. Go to endarirx.com too, and that'll give you more information about Endari and how you can get Endari for yourself. As Dr. Hebert say, if you're not getting what you need from your physician, then go somewhere else. And if you can't get it, then log right in, and a team of doctors are waiting to service you, and to help you with the things you know are best for yourself. And so we are all about quality of life and better living, and especially for patients living with sickle cell disease. So with that being said, I think that we are ready to take, oh, okay. So I see that Maureen has put our screen up. You see that little QR code there? You can, if you're on your computer, you can take your phone and scan into that QR code. And it'll take you right into our websites to get you started if you wanted to try it via telehealth, or just to get more information about Endari. Otherwise, you can screenshot and save it for later, and then go back in and scan into the QR code and go directly to the information that you'll need to obtain Endari and get started feeling better and having a better quality of life. Right now, we are ready for questions, comments, and responses. So, team, would you like to say anything while we're waiting for those questions to come in?
Yeah. So, Karen, I want to thank Dr. Hebert again. It's always a pleasure to hear him speak. And obviously, like you said, he's a practicing physician, so his time obviously is it's invaluable, and we're just glad to have him on the call. I just want to encourage everybody on the call, if you do have questions, to just put them into the comments so we can answer them. One of the things Dr. Hebert talked about was being a champion for yourself, and talking to your doctor about treatment options. So, you know, when you have appointments with your doctors for your regular visits, whether it's a pain crisis, you know, and you heard about Endari or another treatment that you might be curious about, definitely bring it up and be the advocate for yourself if they haven't brought it up to you. Tracy's our strategic account manager in Philadelphia. She goes into New Jersey, Delaware. We don't always have the opportunity to get in front of doctors due to limitations and access issues, type of barriers that we have to come across. So sometimes we can't get the information to them as readily as we'd like to. So as a patient going in, if you have an idea of something that you may want to try or hear more about, be an advocate for yourself and bring it up. And like Dr. Hebert said, if they're not responsive, you can always go to our website, the one we just posted, endarirx.com, and you can actually set up to find out more about Endari through that site as well.
So I see a question from someone that says, can you talk about the process for the patient to talk to Endari doctors? And I think, Jason, you just sort of mentioned.
Yeah, I was just kind of, yep.
Yeah. Okay.
Hopefully I covered that. But if there's more questions, we'd love to hear more questions, or if there's any comments just about maybe you've had experience with Endari or something else.
Okay. And I think Dr. Hebert is still kind of listening as well. Do you have any questions for Dr. Hebert? Tracy, would you like to share anything about your experiences there in the field with healthcare providers and patients, and how things are going with that as it pertains to the patients?
Sure. I mean, just in general, just to kind of reiterate what Dr. Hebert said, if patients don't know about Endari or are wanting to get more information, certainly just feel free to reach out to any physicians. Most of the physicians in the area have my contact information, or we could certainly make sure that there's a way for Reverend Zamoria and the team to make sure that my contact information is available to help out with any kind of access or information or any type of resources that we have for patients in terms of dosing and side effects, how to take the medicine, where to get it. I'm here, I'm available. If I'm not in a particular area, certainly someone can reach me by phone. So feel free to reach out.
Mm-hmm. And from Emmaus, we want you to know that we understand the journey, and we understand that this is a journey for you. So we want you to let your voice be heard. That's very, very important. Figure out what you're most passionate about on your journey and what you need to work on within your own self-care. Those are just some tips and some things that as a nurse practitioner, I try to share with my patients over the years. And together we can fight to fix things. And so that's important, to not be a sideline warrior, to get in the game, get in your game and fight. And so we hope that today that with the Reverend Zamoria and the Philadelphia, Delaware Sickle Cell Association, that we are enlightening you to participate in your care. If you hadn't been doing that in the past, jump on in, get involved, and challenge your physicians, challenge your healthcare providers. If there are things you need to know that you don't understand about your care, whether it's your lab work, whether it's your treatment options, whether it's some of the holistic and alternatives to treatment, then don't be afraid to voice your concerns. Write things down before you go into the doctor's office. But if, like for instance, if you know that you want to try Endari, then have that ready. As much information as you can have. Sometimes we welcome information if we haven't heard of a certain drug, and that's why we're having programs like today, so that we can share this information with the world. And so write your notes down, take them into the doctor's office. If you've got websites that you want the physician, your healthcare providers to refer to, be ready with that. And so, like I said, don't be a sideline warrior, get in the game. And that's important. And as Dr. Hebert said earlier, we put the power back into the patient's hands. And because you are the patient, you are the person who's on the journey. We want to be on the journey with you. So let us know what it is you need. There's something else I wanted to say about that, but equip yourselves for the journey. And that's a big, important piece. So we're still taking questions.
Looks like, Kara, we have no further questions.
Okay. So if it looks like we don't have any further questions right now, there's some more information that I think will be shared in the final remarks. But again, we are Emmaus Life Sciences. We are the maker of Endari, a treatment option for sickle cell disease in adults and children ages 5 years old and up. And we are here for you. We are here for the journey, and we thank you so much for joining today. We have enjoyed these conversations about sickle cell disease, and talk about Endari. And that's all I have right now. I am Karen Gant, your community engagement manager. Please feel free to reach out to us at any time. Thank you.
Thanks, everybody.
All right. Well, thank you. I want to say thank you to Dr. Corey Hébert. He really laid it on us, didn't he?
Mm-hmm. Yeah, he did.
He laid it on us. And even though there are no questions, know that today's session will be available through YouTube and Facebook. So you'll be able to go back and recapture it. He put a lot of information out there. Maybe you're still processing it or trying to absorb it, which is okay. I do want to acknowledge Karen's comment about not to be a sideline warrior, that you have a stake in your own care. And I love what Dr. Hebert actually stated about if your doctor doesn't know or doesn't believe it, you can go through Endari and talk to their doctors. That will be something important, that if you're interested, it's just really gathering information. As he said, there's a lot of information out there with new therapies, but you have to figure out which one works best for you. He did speak about Endari, hydroxyurea, and that even though you're taking that you can still take Endari. It doesn't conflict in any way. I also want to mention Dr. Hebert's book, Sickle, Awakening the Truth About Sickle Cell Disease. I think that would be an important book for all of us to purchase on Amazon.com. But again, I want to thank Team Emmaus. They are working hard. They are engaged with the community. I know Tracy Evans is the strategic manager, and she's always reaching out. What do you need? How can we help? What do we need to do? So this was an opportunity. We wanted to be able to present this during October for Health Literacy Month. And we're excited about what Endari is doing, what they have brought to the sickle cell community. It's a game changer. It's a game changer. So I just want to say thank you for being with us this morning. And if anyone has any follow-up questions, we have a closeout screen which will have our information on it. But if not, certainly the phone number here is area code 215-471-8686. And there will be a closeout screen with additional information on it. So we thank you again. We're finished in enough time where you can enjoy your Monday, your day off. I know it's Indigenous Peoples Day, and many people are off from work and at home. We're here in the office, but we'll be leaving soon. But we're here for you, and Endari's here for you, and we thank you so much for joining us. God bless.